Welcome to the No Bull Political Arena with your hosts, Sophia Nelson, Bill O'Reilly, Brian Mistro, and TJ McCormick. It's real voices, raw politics, and no bullshit. Hi, everybody. Welcome to the Political Arena. Thank you for joining us here again tonight. I've got with me Michael Faulkner, Reverend Michael Faulkner, who's agreed to join and discuss a subject that I think is very dear to both of our hearts. So today, Thursday, is Thursday Thoughts on the Political Arena. The Thursday Thoughts are nonpartisan, well, as nonpartisan as you can get, where we really deep dive down into a subject and give some thoughts about where the problem is and maybe what solutions that there might be that would actually work. So thanks for joining, Michael. I really appreciate it. And for those that don't know, Michael Faulkner also has his own show. And so I'll let you just briefly do a real quick intro on that, Michael, then we're going to jump into Thursday Thoughts. So tell them a little bit about your show.
Wonderful. Yeah, so it's restoring the American dream, and it really centers around all of the things that we need to do as Americans collectively in order to restore the hope that brought America, that makes America special. And I want to see that restored for generations in posterity, generations into the future. And so we talk about all of those issues which destroy hope or renew hope, and we're going to be renewing and restoring hope. So
yeah, and I've been
hope you can join us.
Yes, absolutely. And I got to tell you, I've Michael has allowed me to join in and participate in this program a lot, and we're gonna have a lot of fun with that. It's in some ways it's similar to our Thursday Thoughts in that we dive deep into subjects, but we're gonna have some fun with that. And I would urge everybody. It's going to be on Tuesdays and Thursdays at 8 o'clock Eastern and 5 o'clock Pacific. So if you can join in, you can watch us live and we can talk about that. So today's deep dive discussion is going to be about healthcare in America. It happens to be a subject that I know a lot about. And Michael, I know that you know a good bit about it as well, given the things that you've been doing. And so we're going to go ahead and let's just go ahead and dive deep into this and let's talk about what the problems are.
Okay. Well,
Okay, so I'm going to put up a slide here real quickly, and I'm going to share some of the frustrations and problems. So here's a few facts. 66.5% of the people that file for bankruptcy file it because of medical bills. As many as 550,000 to 600,000 a year file for bankruptcy because of their medical bills. According to the CFPB, 100 million Americans owe 220 billion with a B in medical debt. And just a couple more little facts here. 14 million people in the United States owe over $1,000 in medical debt, and 3 million owe over $10,000 in medical debt. Michael, system's broken. This system is broken.
It's totally broken. We are the sickest nation of all the industrialized countries in the world. We literally are the sickest. Our life expectancy is going down. Our infant mortality is going up. We spend more, sickest nation of all the industrialized countries, and we spend more than any other country in the world on healthcare. We spend really our money is spent on sickness care because that's what we're doing now. We're not talking about the quality of medical care, the attention that we receive, the medical care that we receive. It's some of the best in the world, some of the best doctors, best nursing, best research in the world. So that's not the quote unquote problem. But when you come into, when you start peeling back the layers of the onion, you look at the drug companies, you look at what it costs to get a drug approved through the
Yeah,
the FTC, and then who makes the money once it's approved? I mean, there's so many layers to the problems, Brian. I know we don't have time on one show, on this show,
no,
to go through it all, but we spend more and we get less for it in terms of sickness. I have some friends, personal friends, who have moved to Europe, who've moved to Portugal because their medical treatment is cheaper in Portugal than it would be for them to stay here in the United States. Now that is crazy.
that is crazy. It's and I'll share some a little bit of personal stuff too. So obviously I'm filming from my boat, so I obviously know a whole lot of boaters as well. And it was very common that you'll hear in the discussions with other boaters what the healthcare was like in Mexico. Um, it's a fraction of the cost of what it is. And this is both dentistry and hospitals. It's a fraction of the cost. But I would say to them, I'd say, yeah, but it's Mexico and third world, and it's, some nasty little doctor's office where you may go out sicker than when you came in. They said that's not true at all. That's not true at all. They said it was every bit as nice, if not nicer, than many of the facilities in the United States. So that's one side of it, and that was to your point about how much we spend on healthcare or getting sick, and what it is in other countries. And I'll share with you too, and I'd like to get if you've had this experience, Michael. But I know of a solid two people that have declared bankruptcy because of medical bills, and actually I know quite a few people that have mentioned it, but I know for sure two of them. Let me just tell you, and one of them is a dear friend of mine, and he was they had a lot of money. They were very well set off. His wife was a real estate agent, and she got cancer. They had insurance, and she got cancer. And by the time they were done with the bills, and she passed away, he had to declare bankruptcy. They lost their
Wow.
house. They lost. He had to give up the house. He had to give up everything. And now he's a 74-year-old man, I think it is, that in order to be able to make his bills work, he has to do DoorDash. So I
Oh my
I,
goodness.
I go back to this, Michael. We have a problem in this country with our healthcare system. Um, have you had, because you've done a lot of work and from kind of missionary work and so forth. What have you seen that? I mean, have you seen bankruptcies and the stuff that you've dealt with? I know you were even part of a mission project. I think was it in Pennsylvania? Or tell me a little bit about that.
Yeah, this was actually in New York. So
Oh,
we
okay.
ran, yeah, I ran the largest faith-based diabetes prevention and management program for a group called the New York State Health Foundation. So it was a foundation grant. It was connected to the New York State Health Department, but it was a foundation grant, and we managed and helped, and it was designed to really help people to know more about diabetes and to be able to do preventative, because diabetes is one of the most expensive health maladies that we have, right?
Yep.
It is the most expensive, if not one of the most expensive, in terms of loss of limbs, loss of sight, and so forth.
Right.
And to a certain degree, it is preventable, not completely, but if you start to manage, you can manage some of the the more extreme results, and most people that have diabetes, if they manage it well, they can live well with diabetes. Now,
Hmm.
drug companies make a ton of money from that, from all the equipment and everything else. So we were doing that. It was called Faith Fights Diabetes. And so we delved into it, and we were able to save some lives, and we were able to help people live longer and live healthier. But we were also able to challenge some doctors to learn more about this specific malady, and so that their advice and their counsel was being given well. But I have a personal story, Brian.
Okay.
My wife and I, we got here to Pennsylvania and everything was, it was great. My wife was working. She's a doctor, not a medical doctor. She's a psychologist. She's
Oh,
working in a hospital in Brooklyn. We relocated here because of a ministry job that I had. And so when that wound down, we were working on, with the health insurance that I had. But there was a gap between, because I took a different ministry position. So there was a gap, and
hmm
we had a choice to pay $3,000 that particular month. Now it was a month gap. She was starting a new job.
hmm
I had just finished my medical insurance, and there was a gap. And I said, well, why pay $3,000? We can risk it. We'll be okay. We're healthy.
hmm
Wouldn't you know it? She has appendicitis. Okay, so she has
Oh
to have an
no.
emergency appendectomy, right? And we were able to get it treated and so forth and so on. The bill was $85,000.
Oh my
Yes,
gosh.
yes, $85,000. So we're like, we don't have that. And they, well, you own your house, maybe we can work something out. I'm like, whoa, 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 you don't understand. I mean, we just got this house. We're winding this thing down. We're not looking to be on a 30-year expansion plan of this thing. So long story short, the hospital was able to work something out for their benevolent fund or whatever, where we were able to pay what we could afford to pay,
hmm
so much each month until we paid that bill down, and they didn't send it to collection or send it. Now, we were very fortunate in that we both had incomes and so forth, but I cannot imagine what that's like. And then I have another story, Brian.
Okay.
My wife, my wife that passed away, she had lupus and I was widowed after 32 years. Um, she was very, very sick at the end and had to be hospitalized. And the social workers came to us and they said, listen, in order for this to work, you're going to have to separate. And I'm like, what? What are you talking about? And they said, as long as you have your home, uh, we cannot treat you as, on certain programs without, with private insurance. I'm like, why? She said, because there was a limit. But public insurance, Medicare, you will be extended the full coverage that you need. And I said, I'm not going to abandon my wife. And so you have to make
Oh
those
my
kind of
gosh.
choices to not be in the situation where your friend was, because there are ways to separate that. But here's the thing: what kind of system do we have that charges so much, and then when we need it the most, is not there for us and is going to collect their pound, their 2 pounds, their 10 pounds of flesh, in order for us to pay for treatment and for the kinds of care we need.
Yeah, 100%. And I'll share another little personal story, and I know you know this. I had one of my closest friends, who I considered a brother, had diabetes, and I won't go into all of it, but I will share that uh, because of his diabetes, he ended up having to have a leg cut off below the knee. And so and I was right there with him the entire time. And he went to go to a specialist to get, another leg that, a mechanical type of leg that he could strap on so he could still walk. That leg, the price of it, that mechanical leg, $75,000. $75,000. That didn't include the doctor's visit. That didn't include the fitting. That didn't include that. That's just for that leg. So it's the cost of this stuff is just astronomical. I mean, it's just astronomical. I want
And
to. I want.
was it covered by insurance? It wasn't.
He had Medicare, and unfortunately, he passed away before he got was able to use that leg. But he had Medicare. How much of that they were going to cover, I don't know. But
Yeah.
still somebody's going to have to pay for that. Okay, I mean somebody is paying for that. Let's switch over. I want to share something else, and it's another it's another subject I happen to know a good bit about. But let me read this slide for those that are watching, or if you're just listening. Um, the Emergency Medical Treatment and Active Labor Act requires hospitals to treat anyone who shows up in the emergency room. These uninsured patients cost hospitals a staggering $10 billion a year. The hospitals pass this cost along to Medicaid. That cost is added to your tax. Um, and I'm going to go to another slide here in just a second and chat about it. But before I do, let me just add a little ad lib. Okay, that was put in place, if I'm not mistaken, by Ronald Reagan. He's the one that put
Hmm.
that in. And so, effectively, what it says is that if somebody comes to an emergency room at a hospital, it doesn't matter if you owe that hospital $1 million. It doesn't matter if you're here illegally or legally. It doesn't matter who you are. Okay. If you go into that hospital emergency room, they must treat you and stabilize you. And if they don't, they would get their rear end suit off until the end of time. And so, and I agree with that, by the way. I mean, we don't need to have people dying and bleeding out on the sidewalks out in front of hospitals. So I
Right.
do agree with that. And I'm going to share a little bit of an aside because there's some misunderstanding about some of this. There has been a number of times that you'll hear people say, "Well, I don't think we need to be paying for illegal immigrants' Medicare or their medical bills to go to the hospital." You weren't. Yes, it was paying for if how that worked is that if somebody came in illegal or not and they couldn't pay their bill,
Hmm.
then that would get paid through a type of Medicare to pay the hospitals. And so there's a big misunderstanding there that people think, oh, so we as Americans are paying for illegals' health care. No, you're not. Actually, what you're doing, the reason they did that is so the hospital didn't have to eat it. And so it was to help the hospitals, not to help the illegal aliens. So I just want to put that out there. And I'm not, this is not a political show. I'm not, this is our nonpartisan time, but I just need to
Right.
clarify that one little thing. Okay, I'm going to read something else and you and I are going to deep dive into it, Michael. So, we've had, as this is in 2026, we have already had 12 hospitals declare bankruptcy. However, the majority of those hospitals, especially acute care hospitals, they don't declare bankruptcy. They usually just shut down. And I've got a personal story about this. So I lived in a little town that had 2,000 people if everybody just happened to be driving through at the same time. And we had a rural hospital there. And it's important that people understand in these rural hospitals how important they are to the communities, because the next hospital outside of where we lived could be 45 minutes away. Okay, so
Wow.
if it's something serious, if it's a farming accident or an automobile accident, or you just catch pneumonia, I mean, you can go through a million things that can happen, and you don't have health care, the ability for somebody to see you in a short period of time, then you put your life at risk. And we're going to talk about a little bit about that in just a second. But there are, of those rural hospitals that we had in our town, there was 1,800. There are 1,800 of those in the United States of America. So,
Wow.
and one of my other jobs was to go about. I was a chief sales and marketing officer for an organization, and what we did is I would travel to different hospitals and sit down with the CEO, the CFO, and the comptroller, and we talk about these very issues. Um, and I'm sharing this because the majority of the people that go into these rural hospitals are on Medicare or Medicaid. Okay, that's just the way it is in these small towns. And we've passed some laws that decreases the number of people that can go on Medicare and Medicaid, and they tried to balance that off by adding in, I think it was $50 billion to try to help support these hospitals. Well, I'm going to tell you right now, that's not going to cover it. Over
Mm.
25 to 50%, and I know this because I've sat down with these people, 25 to 50%, in some cases even more than that, is that supports these hospitals comes through Medicare. Okay, and it's we're going to see a lot of these small rural hospitals just shut down, and people
Wow.
are going to be hurt. And I don't know what the solution is, but that's going to be a problem.
Well, certainly when we think about it, when I traveled to, we were in we had a program called the Atlantic Exchange, in which, students from your European, well, that was Holland. Okay, students from Holland would come here to in New York and stay with
Hmm.
American families, and students from New York would go to Holland and so forth. And I went with the students who were going from New York to Holland to stay. I stayed with a Dutch family, and we got into talking, and at the time, now this was 25 years ago,
Hmm.
and I was talking to them about, okay, well, how much do you pay in your, for what's your contribution for your taxes? What's your,
Hmm.
tax? And they say, well, we're paying about 40%. And I was like, oh my goodness, you're getting,
Right.
but they have, they had, what do you call it? The medicine, the medical plan,
Yeah, that, like the universal health care or something, right?
universal
Yeah,
health care,
yeah.
right? Right. And they had relatively, I mean, it was good health care. Now, if you needed something special or you needed something right away, it might be a little problem. Sometimes you could pay more, or you always had the option to go someplace else and get it. But for the
Hmm.
most part, it worked. Healthy people. That was one of the healthiest group of people in the country, right? I mean, in the world, right?
Hmm.
Now, fast forward 25 years later, I'm thinking, wow, they got a deal, because if you add up what our income tax is and what we spend on health coverage and what happens to us in the event that what our own out-of-pocket
Yeah,
contribution is, it's well more than 40%.
yeah,
It's
yeah,
well more than 40%. And we're still in this quagmire of, oh my goodness, is this going up? Is this Obamacare today and not tomorrow? And what in the world is going on? Well, we have competing interests, because no one is owning the fact that we are an unhealthy nation and spending our way into the poorhouse.
yeah,
So nobody's adding that up and looking at that and owning that. We've got to come up with a solution, that, because the one group that we have mentioned here in this equation are the insurance companies,
right,
because they make money no matter what.
right,
And my wife and I, we're on Medicare. We've reached that age, and thank God, because it's a great system.
right.
Um, but I had one insurer who was, and because of the medical issues that I've had and so forth, they changed their policy this year, and it was no longer applicable. It was no longer going to cover enough of the medications that I needed in order to maintain. And so I switched carriers. It was a huge difference. It actually saved me money and so forth and so on. But my point is, insurance companies, they're going to make, they can change their actuaries. They can make a profit no matter what. Talk about too big to fail.
Mm-hmm.
They're too big to fail.
Mm-hmm.
They're
Yep.
going to make money no matter what. They have they've earned that right, and they can tell you who they can cover and how much they can cover and so forth. So we've got a mess on our hands, and until Congress unifies and together around fixing it, it'll never be fixed, because the competing interests. And Brian, this, one of the biggest lobbying groups are those who lobby, right? Doctors and those who
Yeah.
lobby, the
And
medical,
the pharma
the
companies, the pharma.
pharma companies, big
Yeah,
pharma.
yeah, yeah. Absolutely. I know they do. I
Unbelievable.
spent 25 years in pharma. I can tell you. I mean, it's
Yes.
absolutely. So I want to. We've only got 5 minutes left. I want to jump to something, and because you brought this up, let's look at some really hard numbers. So if this is going back to 2024, but this is more or less where we're at right now. How much does America spend on health care? We spend $5.3 trillion. That's with a T on healthcare. That comes out to $15,500 a person. Healthcare is 18% of our GDP. 18%, and it's growing.
18%.
And it's growing at a rate of 7.2%. And here comes the insurance companies. Private health insurance is $1.64 trillion, or 31% of the entire expenditure goes to private healthcare insurance. Medicare is 1.12 trillion, which is 21%. Medicaid is 931, just a little under $1 trillion, which is 18%. I'm going to share just a couple of other things, and then you and I are going to break this down real quickly. Hospital care, of the entire breakdown of what's spent. So $1.63 trillion of that goes to hospitals. Physicians and clinical services is 1.1 trillion, and prescription drugs is about a half $1 trillion. It's 467 billion dollars. So that is a truckload of money that's going into healthcare. I mean, what are we looking at? I forget what they say. It was 18% of our GDP goes to healthcare. Nearly a
18%.
fifth of our nearly a fifth of our GDP.
Right. And
I
and and here's the kicker, Brian, we're not getting healthier.
Yeah,
In
and
other words,
we're not getting that kind of money healthier. That's for sure.
no. It's like we're spending more than any other industrialized nation in the world, and we're getting less for it. We're getting sicker. There, every time you turn around, there's a new disease, or there's a new malady.
Hmm.
There's a, and there's a solution, of course. The drug companies have a solution, and now they can
Right.
advertise on TV to advertise, which their budget goes up. So it's crazy.
It's
It's got to be
insanity.
looked at from all of the angles if we as a nation want to continue to survive, because we can't spend our way to a healthier nation. We're going to have to do a whole lot. And every so often there's a push from the White House to get healthier, eat healthier. And yes, those things help. They absolutely do help. Healthier lifestyle absolutely can change, but not everybody, right?
Yeah,
And
yeah.
not everybody. It's not a guarantee. It's gonna make a difference. I mean, diabetes. I'll give you is one example, because type 2 diabetes. It can be managed through weight loss, but those people who can't lose enough fast enough before the onset of diabetes, they're kind of stuck
They are.
with that.
They are.
So
They are. The only way they're going to survive at some point, is, I'll tell you from experience, and you have the same experience, is through dialysis. And generally, that'll take up, at least from my friend's perspective, this would take up roughly 4 to 5 hours of his day. It was no less than 3 to 4 times a week, and many times it was every single day of the week. Well, how are you going to be a productive, bringing home money? Forget the cost of the dialysis for just a second, okay? I mean, you're not working while you're sitting in there on a dialysis machine in one of these facilities. And so I don't know what the answer is. I'm not saying that the answer for us as a country is to do Medicaid for all or single payer. Um, but I am saying that, and this is a subject we should dive deeper into your show, Michael. Let's do that. But what I am
yeah,
saying is, now that you've watched this, folks, do you see the complexity in the size of this problem, and that this country's healthcare is broken? So we've got to
right.
do something about that. Thank you, everybody, for joining tonight. Listen, if you're watching this right now, you're watching it live on YouTube, please subscribe to our channel. You're going to get, of course, the same programming that you've got here with the political arena. You're going to be able to watch Michael Faulkner's program, which is what we do on his. Is we really do deep dive subjects. You're going to get to watch the Hinge of History, which is not a political program at all. The Hinge of History is talking about AI, how AI is going to affect us. And there's no politics discussion in any of that. So make sure that you subscribe, like it. If you want to leave a question, please do, and we'll answer it. We'll put it on the show and so forth. So thank you, everybody, for joining us tonight. Thanks, Michael, for joining. I really appreciate it,
Hey,
as
my
always,
pleasure. My pleasure.
with your perspective. Thank you so much, and we will talk to you soon. Thank you, everyone.
The No Bull Political Arena is on all major social media platforms. Make sure to give us and your host a follow.
Hey everybody, this is Sophia Nelson. Follow me at I am Sophia Nelson on every one of my social media platforms.
I'm Bill O'Reilly, and you can reach me at Twitter at WFBOR.
Hey, this is TJ. Follow me on X or Twitter at TJ McCormack.
This is Brian Mistro, and you can follow me on X at Brian_Mistro or follow along on Facebook at Brian.Mistro.
A No Bull Media Group member.